Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the hip joint biomechanics. That is the structure and function of the hip joint. So first is the introduction. Hip joint is otherly known as coxofemoral joint, formed by the articulation of acetabulum of pelvis and head of femur. These two segments formed a ball and socket type of joint. And this joint is having the degree of freedom that is 3, allowing or 6 physiological movement, that is flexion extension, internal rotation and external rotation, abduction and adduction. And the primary function to support the weight of the head, arm and trunk, which is HAT, both in static, that is erect posture, and in dynamic posture also, that is ambulation, running, stair and climbing, etc. So this figure represents the structure of the hip joint. So hip joint is formed by the acetabulum of the hip bone, that is pelvic bone, and the head of the femur. Next is the anatomical consideration. The hip joint is composed of a pelvic acetabulum, acetabular labrum, the head of the femur, femoral neck, joint capsule, ligaments, capsule, muscles, blood supply, etc. And all these together provide the hip joint sustainable stability, flexibility and strength. So first is the pelvic acetabulum. So acetabulum is a concave socket of the hip joint, is located on the lateral aspect of the pelvic bone. Acetabulum is not completely spherical, as it has notch in its inferior region, which make it horse shaped. The periphery of the acetabulum, that is lunate surface, is covered with hyaline cartilage, and the horseshoe shaped area of the cartilage articulate with the head of the femur, allow for contact stress to be uniformly distributed. The articular cartilage is smaller in women than in men, and the acetabular depth can be measured by central edge angle of the Wiberg. So in normal person it is more than 25 degree, and in the case of hip dysplasia it is less than 16 degree, and in between, when there is a range from 16 to 25 degree, there can be a possible dysplasia in the hip. And the femoral head coverage is largely determined by acetabular depth. First is acetabular dysplasia. It is a shallow acetabulum decrease covering of the femoral head. Coxa profunda, that is excessive coverage of the femoral head and acetabular protrusion. In coxa profunda and acetabular perfusion, there is a decrease in the range of motion and impingement in between the femoral head and neck junction. Next is anteversion. Anteversion means acetabulum far anteriorly in the transverse plane, that is less inclination. Retroversion means acetabulum far posteriorly in the transverse plane, which result in the instability, that is more inclination, and result in more impingement in the hip joint. So all these factors of the acetabular abnormalities leading to pathologies like excessive cartilage wear and osteoarthritis. Thank you.